Hello guys, this is Vamshi Krishna. Good morning everyone. Today we will see basic and important questions from the endocrine system. So the first question is location of thymus gland. Options are in neck, between the lungs, below the heart, above the stomach. The right one is option B, between the lungs. So the thymus gland here you can see it is just look like a thyroid gland, but the thyroid gland is located at the anterior portion of the neck. Okay, so the thymus gland is located at the between the two lungs. Option B is the right one. The next one is what is the action of ADH? ADH is nothing but antidiuretic hormone. Options are increase urine production, decrease urine production, maintain body temperature, oliguria. The right one is option B, decrease urine production. So antidiuretic hormone it is working on to reduce the urine production from the kidneys. That is nothing but ADH. Anti is against. Diuretic. Diuretic is nothing but to produce the urine. Hormone is nothing but hormone. So antidiuretic hormone is working on to decrease the urine production. The next one is which hormone produced from the posterior pituitary gland? Options are oxytocin, growth hormone, TSH, testosterone. The right one is oxytocin. So oxytocin is produced from the posterior pituitary gland. The next one is location of pineal gland. Options are hypothalamus, epithalamus, thalamus, tencephalon. The right one is epithalamus. So the location of the pineal gland is at the epithalamus. Epi is nothing but above the above the thalamus. Okay. Below the thalamus is the hypothalamus. Above the thalamus is the epithalamus. Epi is nothing but it is always upwards. The next question is anterior pituitary also known as. So what is the other name for anterior pituitary? So the pituitary gland it has the two portions anterior and posterior. So anterior pituitary it is also known as adenophysosis, neurohypophysosis, corpus callosum, arachnoid villi. The right one is adenohypophysis. So it is the other name for anterior pituitary. So the posterior pituitary other name is a neurohypophysis. This is posterior and this is anterior. So these are the other name for pituitary gland portions. The next one ACTH is higher in adrenocorticotropic hormone. ACTH is nothing but adrenocorticotropic hormone. Options are in early morning, in the evening, afternoon, or night. So the right one is early morning. So ACTH hormone is higher in the early morning. The next one is thirst center is located at. Options are cerebrum, hypothalamus, cerebellum, medulla oblongata. The right one is option B, hypothalamus. The thirst center is located at the hypothalamus. Complication of total thyroidectomy except, okay, except you just keep on mind on only except. Options are hypocalcemia, hypercalcemia, hoarseness of voice, parathyroid loss. The right one is hyper hyperkalemia. Okay, so the hypercalcemia will not present in the case of total thyroidectomy. The next one is what is the action of calcitonin? Okay, calcitonin. What is the action of calcitonin? Options are to increase the calcium level, to decrease the calcium level, to maintain the bone formation, none of the above. The right one is option B, to decrease the calcium level. So the calcitonin hormone, which is working on to decrease the calcium level in the blood. The next one is number of parathyroid glands. Options are 2, 3, 4 and 8. The right one is option C, 4. Okay, the thyroid gland will be looking like a, okay, so this is like a thyroid gland, but the parathyroid glands are which are present posterior wall of the thyroid gland. So these are the small glands which are called as a parathyroid gland. Para is nothing but related. Thyroid is the thyroid gland. So the parathyroid glands which are located at the back of the thyroid gland, and it has the four number of parathyroid glands are present. The next one is stress hormone is. So which one is called as a stress hormone? Options are gonadotropins, insulin, cortisol, growth hormone. The right one is cortisol. Cortisol is nothing but a stress hormone. When the people are being in the stress, the cortisol level will be increased. The next one is corticosteroids naturally produced by. Options are thalamus, ovary, thyroid gland, adrenal gland. The right one is option D, adrenal gland. So the corticosteroids hormone which are naturally produced from the adrenal gland, it is also nothing but suprarenal gland. Why? Because the adrenal gland which is present over the kidneys, okay, if you think it is a kidney, the superior part of the kidney we can observe the adrenal gland. So it is also known as suprarenal gland. The next one is HbA1c glucose level is monitored. Options are over 2 days, over 15 days, over 90 days, over 30 days. The right one is option C, over 90 days. For every 3 months, the patient who are suffering with diabetes, he has to undergo HbA1c blood examination for the over 90 days. Next one is normal normal glycosylated hemoglobin is. So what is a normal level of HbA1c? Okay, HbA1c is nothing but glycosylated hemoglobin. Okay, glucose is combined with the hemoglobin, that is nothing but glycosylated hemoglobin. Options are less than 5.7, more than 5.7, less than 7.2, less than 1.2. The right one is option A. Option A is a less than 5.7 is a normal level of HbA1c, that is nothing but glycosylated hemoglobin. So the next question is which hormone secreted by zona glomerulosa? Options are estrogen, aldosterone, adrenaline, cortisol. The right one is aldosterone. So the zona glomerulosa is a part of adrenal gland. Okay. So the upper portion of the suprarenal gland, that is nothing but adrenal gland. It is called zona glomerulosa. The next one is the hypersecretion of growth hormone leads to. So when the people in the condition of hypersecretion of growth hormone, so what is the condition? What is the condition of due to the increasing of overproduction of growth hormone? Options are cretinism, myxedema, acromegaly, Graves' disease. The right one is option D. Sorry, option C, acromegaly. So the acromegaly is condition due to the hypersecretion of growth hormone. The next one is diabetes insipidus due to deficiency of. Options are ADH, insulin, glucagon, renin. The right one is ADH. ADH is nothing but antidiuretic hormone. Due to the deficiency of ADH, the person can have diabetes insipidus. So we will see some of the glands in the human being. The glands are hypothalamus, pituitary gland, pineal gland, thyroid gland, parathyroid glands, thymus gland, adrenal gland, pancreas, ovary, and testis. So these are the glands are present in the human being. So we will see each one. So which hormones will be secreted from the each gland. So the first one is hypothalamus. So hypothalamus is work with the trusted source of pituitary gland to control the hormone production. So hypothalamus is working on the pituitary gland to produce the hormone. So this include thyroid and parathyroid glands, adrenal glands, pancreas, ovaries, testes. So that endocrine system is responsible for the maintenance of blood pressure, okay, heart rate, production of digestive enzymes, and the maintaining of balanced body fluid. So that the hormones which are present in the human being, okay, so these hormones is working on to maintain the blood pressure, heart rate, and production of a digestive system, and all over the body balanced fluids, okay. So the next gland is, so this hypothalamus will produce the corticotropin releasing hormone, dopamine, growth hormone releasing hormone, somatostatin, gonadotropin releasing hormone, thyrotropin releasing hormone. So all these releasing hormones which are produced by the hypothalamus only. So these releasing hormone will work on the other gland to produce the to produce a hormone, okay. So the hypothalamus is working on the other glands to produce a hormone. So this the master gland is also known as hypothalamus. So the next gland is a pituitary gland. So the pituitary gland has the two portions. So the anterior portion will produce the hormones like growth hormone, prolactin, ACTH, FSH, TSH, and LH. So these hormones will produced by the anterior pituitary. Posterior pituitary will produce the oxytocin and ADH. So the next gland is thyroid gland. So the thyroid gland will produce on the trithio, trithyodothyroxine, okay, and T3 is a thyroxine, T4 is a thyrocalcitonin. So these hormones produced by the thyroid gland, and the parathyroid gland is to produce the parathyroid hormone. So these three hormones by the thyroid gland, this one hormone is due to produced by the parathyroid gland. So here you can see the thyroid gland, okay. So back of the thyroid gland we can see the parathyroid glands. So the next gland is a pancreas, okay. So the pancreas has a endocrine function. So among that, the alpha cells, beta cells, and delta cells present in the pancreas. So the first alpha cells is to produce the glucagon, beta cells are the insulin, delta cells are somatostatin. So these hormones are produced by the endocrine part of the pancreas. Why? Because the pancreas also have the exocrine function. So the next gland is a adrenal gland. Adrenal gland is nothing but suprarenal gland. So here you can see the kidney, and superior part of the kidney has located by the adrenal gland. So the adrenal gland has the three parts. First one is a zona glomerulosa. This is outermost part. and it produces on mineralocorticoids. Okay, mineralocorticoids are produced by the zona glomerulosa, and zona fasciculata is the next part of the zona glomerulosa. So this one is produced on the glucocorticoids, and the last one is the adrenal medulla. This is catecholamine, epinephrine, and norepinephrine. So these hormones produced by the adrenal medulla. Medulla is nothing but innermost part. So here you can see the parts: zona glomerulosa, zona fasciculata, zona reticularis. So these three parts will produce on different types of hormones. Next one is ovaries. So ovaries is present in the only female reproductive system. So these are the two ovaries. So this ovaries is working on to produce the estrogen and progesterone. So these two hormones is mainly for the reproductive system, sexual development, and all the menstruation and pregnancy, everything is maintained by the estrogen and progesterone. So the next one is the testis. So the testis are present in the male reproductive system. So here you can see the testis. Okay, this is the scrotum, a soft bag. So it consists of two testes. Those are testicles. So these testicles produce the testosterone hormone. It is present in the males. So this is end of my class, guys. Thank you for watching.